I say strategy, I mean that I really believe that organizations these days, because AI is becoming more and more mature, should look at AI from more strategic, enterprise-wide perspective than, again, a point solution siloed approach. We have more and more point solutions, but the problem is that, look, even on the Aidoc platform alone today, there are, let's say, 30 or so AI-driven care pathways. If you implement one every 6 months, in 3 years, you're going to have 6, right? And Ben just mentioned they grew within less than a year from 2 to 10 and now 12. I think the only way to grow with AI is to develop really a holistic, enterprise-wide strategic approach, to really take control and not allow for this, death by 1,000 cuts. So when we work with health systems, really recommend creating a governance process of AI, right? And it doesn't have to be complex or onerous. It can actually streamline and accelerate. It doesn't have to slow down. And those are kind of the 4 steps to think about and I'm sure many of you are already advanced in your AI thinking process. So, and you might have even more sophisticated frameworks. But the way we think about it is you have to choose the right use cases that you believe are going to actually solve problems. Choose how you integrate it in a way that is great for the physician workflow. Think about the value adoption. I think Ben mentioned the wow moments. I think that is such an important point. Like, how do you create engagement? How do you make these initial people that resist to enthusiasts at the end? And then how do you govern that moving forward? How do you monitor for data drift and make sure you have transparency towards what's happening with the system? With that said, so I love that, we started with Jeff talking about why AI from a macro is really important. Then Ben gave us the details of how it's actually being done in practice, and hopefully this helps connect, and why I think Memorial has been so thoughtful in the way they did this. I think they've took exactly the right steps into making sure they have a scalable approach from the get-go.